Well, I think that, I mean, Jane's in Washington, so so the debate in Washington rages on. I mean, I think if you were to go up on the Hill, there's essentially unanimity within the Democratic caucus. I think that people like Bernie Sanders from Vermont and Roland Burris were on the fence, and now they're going to vote for it. And I think you're already starting to see the House Progressive Caucus start to kind of walk back their pledges to not vote for anything without a public option. I mean, the problem here fundamentally is a problem of power, and it's a problem of leverage. I mean, it's, I agree with Liz that I think the debate's been actually very healthy and good, and has brought out a lot of really important bedrock principles and actually a lot of information about the bill. I mean, it's a classic kind of marketplace of ideas situation where some of the things that Fire Dog Lake have been hammering about, for instance, the annual caps, which was in the version of the Senate bill before it got its final manager's amendment, that got taken out. And partly that got taken out because people at Fire Dog Lake and other places were really hammering the bill on it. So I think the debate has been productive. I think the fundamental issue behind all this is the fact that the left, progressives, just don't have sufficient power right now. We don't have enough power in Washington. We don't have enough power in the country. And the big question going forward isn't, did so-and-so sell us out? Did so-and-so not push hard enough? But how do we build more power? I guess I think politically that the bill is probably at its nadir right now. I think there will be a bump once it passes, just because I think, this sounds really kind of in some ways debased, but I got to say, even at this basic level, it seems important to me for the American people to see that for all as disgusting as the Pharma bill was, and I agree that was really it really almost pushed me over the edge, that the government can at least address issues other than, starting wars and bailing out banks. And so for the government to pass a big healthcare bill, I do think in the very short term is going to have a politically beneficial effect, not just to Democrats, but I think this is just the cause of progressive governance. Now, the question is down the road when the implementation starts, are the Democrats held responsible for higher premiums? I think there may be latent backlash when that happens. But again, I think the deeper ideological premise that this embeds is probably fundamentally a good one over the long term.